phone number of the medical officer of that center. I need to call and know what's happening. And I called, and of course, he didn't embrace the idea because he just felt like, they're fine, there's no problem. And when she called, they told her that don't worry, we'll say even if it is there, the child will grow it. And I'm like, okay, what do we do? There's lack of awareness. So there is still a lot of work that is to be done. And we are hopeful, we are believing that with this training that we have received, we will create homelessness. God helped us, Dr. Sharon and I. In fact, she was but she sends them to us. It looks like a little thing until we diagnose and treat. That's when we know the weight of what she has done from this training that we have received. Now, this is me screening babies in last weeks. Me dilating the babies. So even babies that are still in incubators, they need to be screened. Once you see that they have survived, then they have 100% right to vision. So they need to be screened. This is me treating a baby in the theater. You can see how tiny the baby is. You wonder if there a human being under the white clothes. Yes, there's a child there. So these 5 months, these 8 months we've been back, have we had challenges? Yes, we have. We're seeing more the need. Now, advocacy because the whole area really doesn't seem to matter. But if FEMA, that's the management board, enforces it and says, someone in people, if your babies are not going to be screened, that's advocacy, it's a law. So we're seeing the need to not just create awareness, but to advocate and make it a law that any medical center should have their babies screened as long as they survive. I had shared this with the team leader and the governor. We need retinal tolerance. Yes, we know resource may not be available presently, but it's a need, and we need laser machines. Yes, there's a baby I screened yesterday. I've been screening that baby for 4 months now, maybe 7 months old. If we had laser, then the baby would have been laser maybe at 4 months, and maybe we come out of the screening program. But once we don't have it, we keep screening until the retina is fully vascularized. So there's also the need for further training. Like I said, the baby that we met with partial retinal detachment, but because we don't have the training to carry out that's a vitreoretinal surgery, there was nothing that could be done that we online, even in the eye that still had a chance. So there's still the need for further training to carry out surgery in advanced cases, such as retinal detachments. So we are VTT team and we are ready to go. And we thank you for the community that you have been in our lives. Thank you. This is us eating rice. Rice. Put it that we sit on the floor. We eat it out.
It's a nice experience. Sound.
Thank you so very much, Dr. Olumode.
Now, this t-shirt was given to us by
Yeah.
Okay. Well, that was interesting and eye-opening presentation. I want to thank you so very much. My PhD, this is a very wonderful. And I think we can start something big out of this. I'm so impressed that after coming back, you guys have gone ahead to impact your community. That's the essence of a VTT. You will give me a copy of this presentation. Luckily, we are at the point of writing final reports. I'm going to include this, and we can bring another grant out of this. It may not be VTT. You can get another grant. Tell us your specific requests. You can make a grant out of this. That's the essence of this VTT. So impact our community, and you already started doing that. So I'll want a copy of that. Use it to do my final report of the VTT, which is the stage we are in now. Thank you for letting us know what went on there. I mean, this is marvelous. I'm so happy that you are all part of all of this. Can we have a PhD Lawson? Is she on?
She just logged out. She just logged out. I'm trying to call her to look back.
It's not in the-
Hello, ma'am. Emma, you can log back in, but the lead wants you to speak today. Yes, ma'am, you can log in.
Business.
The other thing I want to say, and I think I've told the team leader, part of the grant, I think we still have some money in India. And because we want to write the final report, they want to utilize the remaining funds to get some equipment for you. Because if they don't, that money will go back to Rotary Foundation. And have you been able to speak with Dr. Dakshin?
Well, I was,
Please.
she said she's in Dubai. And that maybe in the next week, they will arrange for us to have the meeting.
Okay.
That's,
Tony just says a temporary report. At least we'll send you something. And then before, when you discuss with her, we'll see how much of equipment that can make. Like I said, we can also make another grant out of this. I think we should just aim at that. Well,
So she's back in.
okay, tell her to unmute. PDG Lawson, can you unmute?
Unmute.
Okay. All right, you are most welcome once again. Thank you for joining us.
I'm here. Hello,
We have just watched a very interesting.
I'm here.
Okay, can you talk to us?
Elizabeth.
Yes, ma, we can hear you, ma. You can speak to us, ma.
Because the network has been very terrible. My district governor.
Yes.
And dear VTT team, distinguished Rotarians, good afternoon. I'm very sorry, please, that I had to leave just to enter a place and then come back inside the car. That was why I had to leave briefly, but I'm happy that I'm able to still speak. Let me get to a place where you can hear me better. Avoid any noise. Okay. Yes, I am delighted to join the district governor this afternoon to welcome our VTT team back to Nigeria and to the district. Though it's been a while, but trust our district governor, he will never forget to formally and to warmly welcome you back. And I'm happy that I'm able to talk, even if I'm not there physically. The DG knows the reason why I cannot join there. I plan to be there, but for other engagements, it made it almost impossible. But I want to congratulate you, the team, for good experience that you got and that you have shared. I've listened to the team lead spoke, PhD Tunde Solu. I've listened to another presentation and the one that is being shown on the screen, which shows that the period you spent was absolutely amazing, successful, rewarding. And we know that this will actually give our district a edge or an edge over others because you will put to test all that you have learned over there, and you will ensure that our vision for our mission for vision exercise at the district at all times. You'll be available to be part of it and to show your expertise as it's well now. So once again, congratulations, welcome back. And district governor, congratulations too, that this has come to a logical conclusion. And we now have a team that we know will be very, very useful to us in our district. Once again, I want to warmly welcome you back. Tunde Solu, thank you for leading the team successfully. Thank you for being the father figure there. Thank you for all you did for them. Thank you for the guidance. Thank you that you made us proud. Thank you. Welcome back.
Thank you very much, PDG.
Thank you.
Your information on PDG Kola Shodipo is also with us, as it was when we were sending them off.
Oh, I didn't see. I didn't see him clearly.
Yeah.
My please, apologies, please. You are highly recognized.
Yeah, well done.
And all the core team are also here.
Thank you.
Thank you very much. Actually, you are the one that initiated this project, and that is the more reason why we have to give you special appreciation. Thank you very much for dreaming it.
Thank you very much, my DG, for the honor. Thank you, sir.
Yes.
You made it happen, my DG. You made it happen, and that's the truth.
No, Dave. When we're
somebody can
almost
say something, but if it's not driven to logical conclusion, it's a waste.
Well, we are at the stage. I've seen the certificate that you are given. And, okay, all right.
Yes, I am from Rotary Club of Minafrica. Personally from Dr. Kaka.
Okay.
Thank you so much. Now, I know that we usually share lapel things. So I got there. Yeah, so I will give to the governor. So governor will now share it with the guys. Governor.
The person that is representing the Rotary Foundation here, obviously, because they are past graduates. So it's my pleasure. Thank you. Yes. On his own. Thank you, sir. Thank you, sir. All right, thank you very much. I'll be sharing. Thank you very much. Thank you. Almost from you. Thank you. Are you going to pick something? Yes, so you want to retaliate. This is an opportunity for you to spend me more. Don't give me anything in this region. Yes, I can pin an executive. I've not any opportunity to talk to say magic. She magic here. Yes. Well, my opinion is, yes, sir. I think they are not, they are having two certificates for one program. So I'll send you one the trust for mentors. And I think I will be equally good to so first of all, we present to the
On behalf of the district governor and all of us that have been able to put this together, I want to congratulate you and also present this certificate of participation to you as regards the Rotary Foundation Global Grant on Vocational Training Team. Presented to you specially, past assistant governor today, so you team leader for the team. Oh, granted. Congratulations.
Next, Sharon.
Congratulations. When you are eventually, your club eventually chartered, please invite us so that we can raise the occasion and let them know the quality members. Whenever comes to your mind,
I will find you another place.
Congratulations.
Dr. Indian Malaki.
The Malachi, right? Okay. Congratulations. I wish you.
Wow. This is lovely. Thank you so much. Thank you.
Thank you.
Please.
Mortgage. Okay, okay, oh, across the congratulations, and I wish you well, madam.
Can you take this for? For your information, it's 9111 as the collaborated with the Eye Foundation Hospital to operate 1,000 cataracts. As we speak, we are almost at 900. We are going to hit the 1,000 before the end of June. So these are the kind of partnerships that and you are part of the one that happened at Indo.
We just finished 750. The last one we did 8.
Yes, that's Indo.
I know, yes, airport.
Yes.
So the last such 70.
It's a lot. You know the number of families and generations that we passed on. God bless you.
And when NAMPA came a few weeks ago, they also did some, but particularly they did glaucoma surgery, which is not common. It's not common. Doctor, you are there.
Yes, sir.
Can you just give us
That's interesting.
a summary of what happened?
Yes, sir. So the AMPA, in collaboration with Rotary, had training for ophthalmologists. And it was well across Lagos, not just Lagos, people traveled in for that training program. So it held at the Indo Eye Foundation. So we had a series of lectures and hands-on surgical skills in past. So while some people were upstairs, some of us were watching audiovisual training downstairs, and some surgeries quite uncommon, like the glaucoma which the right surgery was done and displayed, and placement of shunts were also done and displayed. Trabeculectomy was done and displayed, and it was a good section over there at the High Foundation Hospital.
The glaucoma was it on both eyes or just one?
So usually patients with glaucoma, that's revealing us the points of doing surgery, most times it's in cases. But when surgery is to be done, it's really done in one process. So there are risk factors. The first risk factor is prematurity. So once the baby is born at time. Now, previously in Nigeria, it didn't used to be a problem. Why? Because our preterm babies were not survived. But with technology, our neonates, preterm neonates are going to survive. The baby I treated today was born at 27 weeks. There were some born at 25 weeks, and they are surviving now. So once they are surviving, they now develop the paternal maturity. Now the risk also is when they are born premature, their lungs are not mature, so they need intranasal oxygen at that initial stage of life. So once they have that oxygen, other risk factors may be turbulent neonatal period, sepsis, jaundice, anemia. So that turbulent period predisposes them to develop paternal maturity. Now, because the baby should be born at, we say term is 36, 37 weeks. But what if it is born before that time? The retina is not fully vascularized. So the baby comes out, just a part of the retina has grown, part of the blood vessel has grown. But outside of the uterus and inside of the uterus, the conditions are very different. Once oxygen is given to that child, the baby is surviving, the vascularization becomes harder. They release other factors, and we're not going there. But once the vascularization becomes harder, there are proliferations, tissues grow, and then the retina is. So, but with yes, ma'am. Yes, ma'am. So with screening, we detect it at the very early phase. So once it's detected at the early phase, we treat. But if it's not detected, it progresses and leads to the
Now, when it is fixed, is it a long-term thing or it's an everlasting thing? Is it a short-term? There's a permanent. Is it not?
yes, ma'am. Yes, ma'am. So once we treat,
Problem is
and we-
identifying it.
yes, that is the solution. Screening.
The child is free from.
It's free. We keep monitoring the child.
Has to do that. It's
Yeah, diabetic people have retinopathy. It's not the same.
Okay, can diabetic more than positive in the child? Retinopathy prematurity is that's the pump.
Yes. Yes. But the treatment is similar because they are retinopathy. So even the injections we're using presently to treat is the same they used to treat diabetic retinopathy. The laser we're talking about is the same laser they're also using to treat diabetic retinopathy. But just that the ones for children has to be the one that is the one with the. That's why it's always ready. It's not the laser and the VIO. Yes, but they have lasers that they can sit down and they sit for the adults. So sit, fix your head, and then
Still
keep them.
How about you want to pay for that consultation?
I must thank your team for the opportunity. Because I must tell you that I appreciate the team better after your presentation. At the time, all those speak-ups towards something. At the point, I was almost telling the lady that, are you sure this is what the money that is being deployed? Because every day, increment on that is not happening. My impact know that is something as serious and as impactful and as beneficial to our community, like what you have presented. So I want to thank you, and I want to pray that, like we said, that should be something you pass on and keep on passing on. That will outlive each and every one of us. Fine. Now, the question I want to ask is, this microscope that you are talking about, during your presentation, I saw the first set of babies you showed that. I was almost saying that these are not really big. I was always saying, I'm almost there, I'm almost there. But later on, I got to discover that. And we handle things like that like most of our own tertiary hospitals. Then those microscopes, do we have them?
So that's one of
Those equipment. You mean a blast suit?
Now, let me explain better. In fact, we will bring out some of the things we brought. Now, what she is doing presently is with some difficulty.
Does they have the
There is a machine that they can use to look at these eyes and detect. But there is, advanced machine that is the retina imaging machine, which even in India, technicians can use it. And so the numbers of patients they can see, you can, in one visit to, we can bring in 20 people. But for the one she's using, one, before you even know how to use it, it takes years, training. Yes, training to do it. Now, then over one patient, how long are you going to spend on the patient? So if one imaging machine is available, we can do many patients. And it doesn't need the ophthalmologist to come and do it. If other people are doing it, it's just like camera, you put it there, you snap it. That's what they do there. They are trying to interpret it, what you see there. But even where you cannot say, if it's borderline or something that you're not sure, you bring it to the ophthalmologist and you will see. And so this is what we are talking about. Yeah.
Well, that's why I said that go further than where we are now. And so let's have your final report. Let me have a copy. Let's also have an idea of how much that machine will cost. I'm sure if you contact any of these Indian folks, they can also be part of another government. Well, like you have noticed, India, I think they have the highest number of global grants all over the world. And that particular district that you went to, I think at the time I spoke with that, they had 250 global grant projects. That is one district. So, yeah, there was one reason.
It's a pure Rotary line. No, that there.
Okay. What is this called?
Yeah, you want she will use the,
It's what she's pretty with that.
But
The ones we're talking
this
about.
one, maybe to train somebody to use it for every 3 years, to know how to use it, to use this, you can even
If one
done. So this is the way it is. But do we?
Yes, so because I'm trained from direct residency training to use this to see that. So that's why I could really pick the skill from the ophthalmologist level. So with this, with the baby dilated, I use this lens, so this is a 20 lens here. So with the baby dilated, I turn up the lights here, and then this lens look into the right and see the retina. So because it's arrow here, I cannot just see the retina like that. Because the baby is a preterm baby. Sorry, that's what It came with this, it came with 50 of this and 50 of this. So this is the speculum. Now this speculum was custom made trainer. It's not weak, you can't see this to buy in there. So she went to the manufacturers and give them an idea of exactly what she wants. So you can only see this with us. We use this, we put it in the eye, extract the eye. So we're not crossing the eye.
Yeah.
So
Yeah.
I must keep the eye. No, we use an expensive agent, we put an eye drop and not that. So this is even not the one that will cause pain, this. Oh, so this is an intense one, so this depress the eye so much that we are able to see the eye puffs in. Because the disease is not usually at the center. Yes, ma'am. The disease is usually at the periphery. The eye is at the So if this is the eye like this, we go like this and we depress here so much that when we look in, we're able to see the bulge now. That's when yes, ma'am. Yes, ma'am.
No, we use it to
flatten. Yes.
flatten the eye. So you put pressure on top of the eyeball. It's just like you have a ball. You put it here and then it flattens the eye.
Yes. See that the ball is right.
Yes. So this is how we do it. This is the child's eye. We open the lid with this speculum. So kiss the eye, we kiss the eye, we press the eye, keep the eye there. Until the bulge comes there, it's a contour there.
And then you can see it. So that the retina pops forward.
It's a rigorous process.
It's quick. It's actually quick.
It is, but
It's quick.
without training, it's not very good pilot. But without this training, even though I am an ophthalmologist, because in last suit, we are presently 2 persons that are doing it. And the other person doing it, she got a sponsorship, but she went to England.
Okay.
So that's why she's in. So even in Lagos State, to be an ophthalmologist, even after completing residency,
Some special skill.
Trained to it.
Well,
you said you will not buy.
Yes.
Yeah. So she will be there when you do that.
Pressure.
It will be uncomfortable. Not maybe not pain. The word should not use the uncomfortable.
Yes.
Not pain. This is arrogant.
And then for other grown children that have cancer, and we want to be sure that the cancer is not spread, there's also indent.
I see really.
For adults, don't need to indent.
No.
Now, tell us the difference between this and the imaging machine.
With this, I'm the only one that sees. Nobody sees. I'm explaining to the mother, and the mother doesn't understand why I am worried.
The mother and the father, they hide them along in the sea over there.
But with the people, I'm saying it and I'm showing the mother this is it.
So this is what
what yes, this is the machine.
So the machine there is a screen.
That
It's a computer screen. So what you see here
Yeah.
is actually
Yes.
what she sees
Yes.
is what you see.
Yes.
So when we're having this done in the field there, the mothers of the babies should first, like they have them hold their babies down.
Yeah.
So when this is put, this is the probe.
Yeah.
So we also anesthetize the eye, put like a gel to make it easy, like the gel they use when they're having, so something, a gel that can work in the eye, so they probe it on, and then we get the image. And with this, they send the message directly, teleoptometry, straight to the ophthalmologist if they are not extremely sure what they see. And if they're extremely sure, you can say what stage was zone. And then also you can explain to the parents of the child, this is what's going on. And there's also a picture in here that shows what the norm should be. So this is what we want to have pain, but this is what we have.
and with this, you don't need to.
So no need for indentation and all
This you
that.
don't indent.
No,
Yeah.
With that, it's just.
This is
what should I expect in what we're hoping to get.
Specification. Say speak with the production.
They don't have to indent.
It may not be part of this.
Don't take that book, put it on the baby's eyeball, and then they'll show it just like that on the laptop there.
Yes, ma'am.
Everything is always there.
For every use.
For each baby.
So we have two of these, I think that for the grants. and then 50 of it, 50 of that street.
So do you have any plans to, sorry, to train ophthalmologists in the use of this?
So recently in my place of work, I have about 22 residents that
Only
we are presently 11 consultants, 23 residents.
So it's like.
So part time, per 3 months, I have 4 residents. So for those working under me, we go for the spraying together. I go with at least 1 resident when the work is not too much. So when I see something, I say, okay, go ahead, look at it, let me see it. So trying to pass this thing, so they may not know it's what they can get for the first. Yeah.
That's something like training.
Yeah, I think
so.
Because you said it can take 3 years to learn how to use it.
yes, ma, it took me 4 years.
So the resident is going to be there for like a year.
It's residency 5 years plus 5 to 6 years. So in the course of residency, we are trained to be able to use this. So by the time I was going to India, I already knew how to use this.
Thank you very much. So when we are talking about this thing now, we first have a good understanding.
So the problem like you said, and so it's about survival. Because if oxygen, do this, once the baby now gave where I say, look at him, he was just wait before. See him very fast. That's all. Whereas the issue of the eye can come back later on to just see that the baby becomes blind.
Okay, well, we'll take it on. Make something go back in this.
I think
yes, yeah. Well, for your information, we also have a district eye hospital. Many of you may not know about it. It's located in Rotary. It's owned by districts 9111. What they do basically is at some point I think also yeah, collaborate with them.
Yes.
And it becomes easier when they know that it's a follow-up.
VTT.
Okay,
They're getting results.
Easier to communicate and get that.
Yeah, I think every minute we have spent this thing has been we've learned a lot from the team. I want to thank you once again for representing the 2 districts. So, thank you very much. The DS, over to you.
My name is Civil Partner Investing on return the board of the Skyline District. The one PG from the district now want to discover is so they have to all the way down.
You sponsor the chopper.
Yes, they're probably. And also to our respected PhD, met 2 years ago, when I was we've all known and respected PhD, the devil day access. So when I was told during the course of the program that you want me to, I said, come your face. I come with your golden star. I thought you were going to give us all of those golden star right now. It's nice to look together.
Only for Indians.
Yeah, no, they convert them to Indians, so that's not do with us. You can see go. And you can see that we're in the screen, which will have where goes the orange, right? Put orange people. So we can play with your collections then. It has been said over and over by our district governor, the chief holders here. The little time I've spent here, I've had the experience and how you change lives. Sightseeing. The last one that we're doing at district governor was saying something about the experience with women that have missed for years. And you know, that's when I know the power of what the profession does. I thought it's really doctors are safe for the surgery that actually need something. People that have not seen for many years, besides seeing and side crying, imagine the depth of the feeling matters for them. What you guys have done, travel all over the world to go and learn this, so that can come and help us. People here in our site is a very, very good site. We're happy that you did go there to ground this, for the short picture that you actually get involved. Once again, on behalf of our I'm grateful for making this mission a success. We're happy that just like Ono said that we can use the opportunity to take it a little further. At least by the time we arrive from global ground, the science machine that you're talking about right now, which I feel working international university to actually do the same, same that's on the way needing students. So once again, we'll say thank you. We love you. Thank God for joining us, for being back. Please don't be far from us so that we can always have you in our team. Because I know that you guys are Rotarians, am I right? Because you are putting on Rotary foundation. But if you have not had any picture, trust me, I have really good players that you'll be glad to. So imagine if I may ask you, your locations are. Where do you stay in England? Joe, fantastic. You're in Kenya, yeah? Oh, are you returned already? She's not. Fantastic. See, all I can
Closest to them.
Yes.
I just want it.
I the power of fire.
My DJ, I'm see, please, let your attention come back here. Please let your attention come back. Thank you very much for giving me what I need to hear. Because it is your feeling, the way you went about this stuff. So you have a bit of Rotary in you that you don't know. Now, all the clubs you mentioned, they are fantastic, but there's still one.
All at home.
There's still one. I don't want to mention the name because it's one of the kind. One of the common, I'm not saying the best, one of the common club in art. That's why we name our favorite. I've not mentioned names.
You are going beyond.
I've not mentioned any club name. You everybody has mentioned their club name. I've not mentioned anything. Let's say we will see camera to but all the clubs they mentioned, please don't pay too much attention to them. By the time I hear they're all calling now. You can't visualize them now. I've not called my own and you started it. Well, at this point, once again, I want to say from the bottom of my heart, we appreciate you guys doing. At least I can feel your impact when our chief staff was asking detail about what we get it done. So once again, thank you for making the trip worthwhile. So the investment we put into it is not wasted. It showed that the people that was sent was girls. We have some people that will go for, let's go for. Thank God that you said you come back home early because after training, that means it go too much for entertainment, but you go for entertainment. So I was so happy. So the door is open to you. I want to do one more thing by the permit me. We're having one of the best teaching conference, first of its kind, in the next week. I want you to invite. It's a combination of all Rotarians in our district. We'll be having over 2,000 Rotarians into that venue. Trust me, coming there, Rotary will blow you out of the mind. Right? You see people from different professions, and I'm sure from there, they'll be on the whole thing. So once again, thank you. We love you.
Thank you.
And a special thanks, of course, goes to our past district governor for making this happen and for staying with us all through, even when we had all the challenges. and all the officers. Thank you very much. Fraternal greetings to 9112. Yes. Thank you, everyone. God team. Thank you. Media team. Thank you.
Which one?
No, they didn't. I've asked him to.
No, okay, I want to stop. What was it, presentations? Yes.
Oh, okay.
And they handshake with you.
Oh.
Yes. My PhD, please come forward. And the chairman for the. Let's just sit back. Yeah. PhD, you can join us. Representing. Yes. Okay, next. No, it's not fair. When we just do symbolic for this one. Who are here? Oh, that's that. Yeah. You don't know? We don't press the problem.
Yeah,
Okay. So, we can then.
Yes, please.
I'm taking it. Okay.
Let me give it to you. You don't look like wow.
It's hybrid.
She makes a lot of you.
Delta.
Oh, your movies.
Delta. Former is called.
Say cheese. Before you go, everybody bring their certificate so you can have a group with everybody.
Okay, go.
Did I give you the comment? Sorry.
This one or both?
Yeah, that's good.
Bring it both and spray both.
Now let me give it to this last person.
But don't forget all these certificates when you are going for Senate screen.
And
Sorry,
look like you can take a bow.
Take it back.
You don't take a bow.
Let's just one person between. This one alone is fine. Certificate alone is fine.
For all of them.
No, I think the word that certificate to their chest.
Oh, okay.
Well, we're not going to be
Yeah, that's it.
You are representing 912.
Okay. Oh, okay.
Báwo la já fún yín? Oúnjẹ tó fún mi, òun náà mọ̀. Àjù sí ilé. Ẹni tó wà jù sí ẹ pè mí, pàyọ̀ ṣọ́ọ̀kì lẹ́sẹ̀. Wọ́n ti mú àlàyé ìjọba tí wọ́n ti ṣàṣeyọrí. Ẹ̀rọ ìmọ̀ kẹ́lẹ́ ló wà lóye.
Àlàyé ẹ̀mọ́ báyìí
Only to change it.
He's only one thing that I show you.
Okay, go ahead. Say cheese, Sayo, it's okay, we're all the same kids.
Okay.
Yeah. How much are that? Then cutting can join now.
Only go reach yes.
Yes, like this. I'm cutting it. Yeah,
Okay.
Let's do a short video. We'll just say Rotary.
Okay.
After the count of 1 to 3.
Yeah.
So 1.
First say VTT.
Okay, VTT.
Okay, let's start.
VTT.
Officially, the meeting has ended. Thank you very much. We love you. Doctor, I was mentioning one club.